Hi again. Welcome, Christy. So glad to have you join us. We are really pleased to have this discussion with you because as a behavior change specialist, we are so very interested in understanding sort of what your thoughts are about seeing transformative, sustainable behavior change within a healthcare facility. So we're going to get started with a few questions for you. First, I'd like for you, if you could, just tell us a little bit about your background and your work in healthcare facilities, WASH, IPC, as it relates to behavior change.
Great. Thanks, Joanne. It's great to be here. So I work at the U.S. Centers for Disease Control and Prevention as a WASH behavioral scientist. And for the last few years, and especially throughout and after the COVID pandemic, I've been working a lot on behavior change in healthcare facilities. So among healthcare facility staff, working on hand hygiene, understanding barriers and motivators to practice, and developing and assessing interventions in that space.
Great. Thank you so much. And I'm really glad that you said motivators and barriers, because that's really tied to one of our biggest questions for you. So thinking about your work in settings that are resource limited, specifically hospitals or healthcare facilities, what kinds of motivators and barriers have you found that impact WASH-related behavior change, such as hand hygiene among the staff?
Thanks for the question. Yeah, this is a key piece of this work is really understanding what helps and hinders people when they're trying to practice hand hygiene behaviors and other WASH-related behaviors. What we've seen in some of the projects I've worked on, especially my work has been in East Africa and Central America primarily, but we've seen that one of the largest motivations is self-protection and protecting oneself and one's family from the risk of illness. And to a lesser extent, but still a motivator that we've seen is a desire to protect one's patients, which we would always hope to see. And I think really a very key piece of this motivation is just the perceived risk around the risk of illness for oneself or one's family or one's patients. And we see that perceived risk kind of go up and down. And I think also we talk a lot about motivations that are kind of more reflective and that we've thought about, but habit is also a motivation. It's an automatic motivation, but that's another thing that we've seen really drive behavior. As far as barriers, probably the biggest barriers that we have seen across the board are lack of time and just having competing priorities and working in settings where everything is urgent and there's a high workload and high patient volume, and it's just challenging to prioritize that among other competing priorities. And then also very closely tied to that is lack of resources and materials. And this is tied very closely to time, because if there are resources and materials for practicing hand washing with soap and water, or use of alcohol-based hand rub or hand sanitizer, if it's not readily available where staff are at all times, then the time component comes into play, because then it would take time to go and find those resources. And then finally, one more piece is just some knowledge gaps that we've seen that create a barrier just in terms of understanding alcohol-based hand rub and when and what constitutes patient contact and when hand hygiene needs to be practiced.
Great. Thank you so much. And I can imagine those who are listening really are quite familiar with some of the thoughts you've just shared in terms of motivation dynamics, what people really, consider in terms of why they would or would not change their behavior. And then, of course, that, the complexities of the barriers that you've just been talking about. So if you had to look in your toolkit, I know you've been doing this for a while now, what kinds of strategies have you found are needed to initiate change? And then what are the strategies that will help sustain behavior change?
Yeah, I think you make an important distinction there. I think it's one thing to initiate behavior change, but it's a different challenge to try and sustain it over time. I think we can see when infrastructure is focused on as what's going to be improved, which addresses the issue of resources, and ideally also helps with the barrier of time, that may initiate a behavior change. The novelty of access and new materials being available, but that doesn't always lead to lasting and sustaining change. So we've seen that in a number of studies and projects that we've done, that evaluations have shown that practices decline over time if infrastructure is the only thing that's changed. So to sustain it, I would say it needs to go beyond infrastructure and really focus on behavior change strategies, which of course is what I love to do. And so this can look like a number of different things. You can conduct surveys among staff, knowledge, attitudes, and practices, CAP surveys, to understand kind of where the knowledge gaps are, what attitudes staff have around certain hand hygiene practices. You can conduct interviews. These don't have to be, a big systematic study. It can be informal, talking with staff and trying to understand what motivates them, kind of looking at the why behind some of the challenges they've had. You can also conduct message testing, which is ensuring that the messages you're using or reminders or posters that you're putting up throughout the facility are understood and are context appropriate. And this also applies to different staff within the facility. So if you're working with physicians, nurses, and cleaning staff, the messages and the literacy level may vary even within your facility. And those are things to take into account as you think about how you can present messages to staff. And then I think really for sustainability, you have to engage at the community level, not just the individual level. And in this setting, when I say community, I'm referring to the broader culture of the workforce within a healthcare facility. Social norms really are a big driver of our behavior, and this applies to healthcare workers as well and healthcare facility staff. So I think recognizing that there are trusted leaders in a group and that those people may be followed. And if those people can model this behavior, that could lead to a shift in the culture within the facility and lead to a lasting change.
Thank you so much. That was so very helpful. Those are really practical and concrete examples of things that we can do to see sustained behavior change. Thank you again for that.
Mm-hmm.
So just thinking and staying on this point,
mm-hmm.
for those among us who work in multiple hospitals, what would you say about scale? We can imagine that everything you've described could work very well in one facility, but what about someone who's working across multiple facilities?
Yeah, I think scaling up is always the next challenge. Once you've figured out something in one facility, where do you go from there? So I think that's a great question. I think that there are ways that we can categorize facilities so that there doesn't have to be a completely new, novel approach in every facility. There will be barriers and motivators that are true across facilities as well. And of course, we want it to be as tailored as we can, but recognizing that we don't have unlimited resources to study this and study behaviors, we can look at facilities that are similar and the types of populations they serve. And if those are similar, then those facilities may benefit from having similar intervention approaches. Just for an example, I have worked on projects in Central America in small rural health facilities, and then in large public hospitals. And we did different assessments in those two types of settings, just because the needs and resources available, and even just the workflow were very different in small rural facilities versus hospitals. But we found that we could roll out similar work for behavior change across all 12 rural facilities and all 11 large healthcare facilities. And so I think thinking about kind of similarities and differences in the environment is helpful.
Thank you for that. I do like that, the concept of thinking about in terms of groups and similar characteristics. So again, thank you for that. I think that should help many of us who are working in different settings. So another question for you, which I think a lot of folks ask, is if you don't have a behavior change specialist, such as yourself, on your team or accessible, what is your recommendation on how to either begin or initiate behavior change programs or initiatives?
It's a great question. And I think my answer would be no, you do not need to have a behavior change specialist on your team to get started on this type of work. I think health facilities are well equipped with people who care about health outcomes and promoting a healthy work environment within the healthcare facility can be done by those that work within it. And I think there's a lot of ways this can be done. You can develop a hand hygiene champions initiative. We've done this in a few different settings, and this can involve the selection of staff that are understood to be trusted leaders or role models for hand hygiene or other practices, and empowering them to promote behavior change among their peers. You can look at who else is already there and what systems are already in place. So if there's a hospital epidemiologist who could get involved, they're a huge asset for this type of work, or infection control nurses. If there's a weekly or daily huddle meeting, incorporating discussions about hand hygiene into those ongoing existing conversations. And I think just figuring out what systems are already there and integrating this work through staff that you already have doing this work is a feasible way to do this without a behavior change specialist on the team.
Great, thank you. And I know a lot of us are taking notes here.
Yeah.
So thank you for that. And so my last question for you is really based on the fact that, our platform is really about empowering everyone who listens and participates to take action. So if you could, and just really quickly, what can a person do, or a programmer or someone who is working in the facility do tomorrow to improve behavior change programming?
Thanks. Yeah, I think this can be change that starts now. And I think one of the first steps I would say, if you wanted to go and start this tomorrow, would be to really talk with staff in facilities and just set up opportunities to listen to their needs and their experiences. I think there's really a lot of value in understanding what is experienced by the people that are working in this facility to figure out how systems can be improved and how we can promote behavior change in that setting. And I would also direct you to the World Health Organization's multimodal hand hygiene improvement strategy, which if you just type it into Google, you'll be able to find it. Many of you are probably familiar with it. But I would say this strategy is a good starting point. It highlights different components needed to both initiate and sustain behavior change without getting too theoretical about it. And it integrates both infrastructure and education, reminders, and kind of the larger culture around hand hygiene in a facility, as well as evaluation and feedback, which I think are important pieces as well. So I think if you're looking for something to read through and look at for guidance, I would direct you there. But I would say really the first step is to talk with staff and understand what the gaps are, and then start thinking through what would make sense for adding some behavior change communications, or launching a champions initiative, or whatever you choose to be the next step.
Excellent. Thank you so much, Christy. We really appreciate your time and all of this great information you shared with us. I think everything you have said is quite actionable. And again, really appreciate you joining us.
Great. Thank you so much.